Blue Cross has walked alongside us for many years and helped fund things that are new or innovative. And I think that this community health worker that will be embedded in the hospital emergency room is a really good example of that. Most of our patients are lower income. They have a lot of complex needs. When we think about the social influencers of health, in terms of housing affordability and education and neighborhood safety and access to food, we know that we have a small part to play in keeping people healthy. And a lot of our patients face those barriers related to social influencers of health. But we feel like we're providing really good access to primary care, dental care, and of course, behavioral health care. We treat the whole person and realize that we're just part of a greater wellness ecosystem. We received a $50,000 grant from Blue Cross. And first, I just want to say we have had a great partnership with Blue Cross over many years. And a lot of the funding that they provide to us is put towards new projects or innovative projects. And that's really important because obviously as a nonprofit, we get grant funds, we get philanthropic funds, and oftentimes those funds are needed just to make the business run. When we get funds to try something new and exciting, we really feel like we're breaking through ceilings to provide better care to people. So this specific grant is going to allow us to put a Catherine's employed community health worker inside of the Trinity emergency department. Why that's cool and why that's innovative is because this person will essentially serve two systems and be there to serve a complex population, mostly unhoused or housing insecure. We know that a lot of people with complex needs are using the emergency department as their primary care center or their urgent care center. That is really expensive for the system. It's expensive for the individual. And a lot of these visits are what we call primary care sensitive visits. And so if a patient comes into the Trinity emergency department, our community health worker will be there and say, do you have a primary care provider? Do you have a medical home? And if they do not, we'll be able to get them into any of our primary care sites so that we can connect them to a medical home where they feel a place of belonging, where they feel like they're getting quality care, and where they feel like they have access so they're not using the emergency department as their usual care. And Catherine's could not do innovative, interesting, pushing the barrier work without extra funding from sources like Blue Cross.